The American Grandparents Association, celebrating America's 70 million grandparents, is focused on the health and well-being of you and your family. Membership information available at agagrandparents.com.
It's now the law, and it has a dramatic impact on all of our lives. The Affordable Care Act, often referred to as Obamacare, has transformed the way we get health insurance. The plan is complicated, the changes can be confusing, and they can be frustrating. It is certainly controversial. For some of you, costs have already gone up. For others, they went down. Welcome to our new healthcare landscape. Join us as we cut through the noise and get down to understanding healthcare. Hello, and welcome to Understanding Healthcare. I'm Paula Zahn. In 2010, the first baby boomers turned 64, an early sign that America's largest generation would soon be eligible for Medicare. There are 78 million of us born between the years of 1946 and 1964. And every day, 11,000 of us turn 50. And now we have the Affordable Care Act, which dramatically changes the way we get our health care. As a result, most of you were able to keep your plans, but some of you weren't. Regardless, understanding health insurance and Medicare isn't easy for any of us. So our goal on this program is to help you navigate this very complicated new terrain. First, we are going to walk you through some of the most significant changes under the Act. Then we'll focus on the ways it specifically affects those of us in the baby boom generation. But first, to help us start the discussion, let's hear from someone like you. Let's meet Enola, who recently learned just how important it is for her health care to keep pace with her health needs.
I am passionate about cooking healthily for my family, cooking from scratch, because that heals me from the inside. I'm passionate about knitting, quilting, activities which allow me to create gifts that I have made with love for all the people that I care about. A re-emergence of a health issue has made me realize that having quality health care is important, because I now need to see specialists more frequently than I had. And their tests are expensive, and I need to be able to have that care that I need. Just because a deterioration of my health makes me realize all the activities that I have been involved in and I took for granted. And now I realize how important they are to me in my life. It is important to stay informed, because legally healthcare coverage can change from 1 year to the next. And for me, I have to see more specialists now than I had before. And so staying abreast of those changes lets me know what specialists I can see and what things will be covered and not covered. From here on out in my life, it's important that I stay healthy, because I'm looking forward to my husband's retirement so that we can travel and do all the things that we have talked about, and as well as future grandchildren. I cherish life and I enjoy all of the activities in which I participate. And so I would not like to lose the ability to continue to do those things.
Thank you, Enola. We appreciate your sharing your story with us. What a great example of someone who is advocating for herself, and that kind of empowerment is a goal of this program. And with that, I would like to introduce you to two healthcare experts, James Furman and Dr. Mark Fendrick. James Furman is the president and CEO of the National Council on Aging, a nonprofit group representing older adults and the community organizations that serve them. Dr. Mark Fendrick is a professor of internal medicine and health management and policy at the University of Michigan. He is also director of the Center for Value-Based Insurance Design. It's great to have both of you with us. Welcome.
Thank you.
So here it is, folks. 906 pages in all of the Affordable Care Act. About the only thing I think we can agree on is this changes healthcare. We're not going to debate whether this is a good thing or a bad thing. But I'm wondering, Jim, if you can tell us, as simply as you can, what this really does for us. What is its impact?
Well, summarizing 900 pages in 9 seconds, I would say the purpose...
I'll give you 11.
The purpose of the law is to make sure that more people qualify for insurance, can afford insurance, that the insurance they get covers more services such as prevention and mental health, and once they have coverage, that they can be assured that they'll be able to keep it even if they get sick.
Do you agree with that assessment?
Yeah, even at 900 pages, it's an imperfect statute. I think the addition of certain benefits, protections, and rights is an important step forward, but we still have a long way to go.
You just used the word imperfect, but let's start with what you actually think works.
The first step is the millions of people have now received coverage under the Affordable Care Act who had not been able to do that because either they didn't have the money or they had a pre-existing condition. There's also a statute in there that allows free preventive services for counseling, for screenings and immunizations that has now been utilized by over 70 million Americans. I also think the fact that there's no longer out-of-pocket limits that you could pay on your health insurance, and there's no annual lifetime cap for which some people were concerned that their insurance used to end at a certain amount of money and they were responsible afterwards. And now they could have the solace to know that a financial implosion is much less likely if they get sick.
What doesn't work?
The problems are that the system is still much too skewed toward fixing you when you're very sick and not enough to enable you to stay healthy, which is really important. I mean, it's a system that shifts from a sickness system to a wellness system. The other big challenge for people with Medicare, it's incredibly complicated. You're on your own, and many people are not able to be informed consumers and make the best choices.
So what are the biggest mistakes we make as we try to sign on to this program?
Yeah, well, I think we spend way too much time talking about how much we spend on health care as opposed to what we get for it. In America, we spend 3 times more than just about any other country on the planet per person. And we score in the mid to lower 20s in terms of life expectancy and other types of quality healthcare metrics.
Why is that?
I think we spend too much time talking about how much we spend as opposed to how well we spend. And that we're kind of much more interested in latest technologies and whiz-bang interventions as opposed to sticking to the things that we know that make Americans healthier.
And if I could add to that, the cost disparity between the U.S. and other countries is particularly dramatic over the age of 57. Up till that age, we spend about as much per capita as other countries, but when we get older, we spend 2, 3, 5, even 7 times as much in the later years. And that's because we don't have a system that manages chronic diseases very well. As Dr. Fendrick said, we pay based on volume rather than outcomes, and we do a very poor job of advanced planning and end-of-life care.
I think you've both given us a really good framework from which now to look at this plan from a broad perspective. And I want to now focus on the baby boomers that are under the age of 65. What is the most significant change that this plan imposes on them?
You look at the Affordable Care Act, it takes advantage of trends that were going on already, Paula. First, an emphasis on primary care. And as Enola mentioned, she's talking about her specialists, that we have to have a primary care provider, whether it be a physician, a nurse practitioner, or a physician assistant in charge of her care. So emphasis on primary care and also coordination and integration among her specialists, her physical therapists, and her pharmacists. So we have that major step forward. So I think that there are steps forward to actually get away from sick-based care to well-based care. And also the fact that preventive services are so generously covered for both commercially insured individuals and publicly insured individuals in Medicare will lead us down this path away from focusing on just when you get really sick and in the hospital instead of keeping people away from the hospital and living well in their home.
I think we need to make the point that under the age of 65, you don't qualify for Medicare. So what are the best options out there for you?
Well, for under 65, as you mentioned in the introduction, most people still get their insurance through their employers. And although there was a lot of talk about this, this appears to be steady moving forward. I think one of the most significant advances in the Affordable Care Act is the availability of these state-based marketplaces where people who cannot get their insurance through their employer can go online and learn and choose about the plan that either meets their own needs or, in the case of Enola, her family's needs.
So what specifically should consumers be looking for in a plan?
Well, I think this is a really important point, that our studies show that most people look at the premiums. That's the price they pay to get insured. And health insurance goes far beyond that. And I think that while we talk about visits to see your doctor for a checkup, I think patients like Enola and those of us in the baby boomers should every once in a while have a health insurance checkup, because conditions change. And as your health changes, your needs to see certain doctors changes, diagnostic tests, see specialists, as she said, and more importantly, to take the medications that we use so frequently to manage our chronic diseases. So you need to look beyond the premium to make sure that the services that you might need are covered well. And if you like a doctor or a particular hospital, to absolutely know that those clinicians are in your network.
Two other points about the under 65 market. Some people do qualify for Medicare under 65 because they're disabled, so that's an important group. But one of the important benefits of the Affordable Care Act, a lot of people, before they're eligible for Medicare, 55 to 64, particularly if they're not working, they could have a lot of health problems, and we're finding it very difficult either to qualify for plans or to afford the coverage. The Affordable Care Act makes it much easier for those people to qualify for plans, and they may very well be eligible for subsidies to help pay for that care. So as Dr. Fendrick is saying, one of the benefits of this is that presumably people the ages of 55 to 64 will be healthier by the time they enter Medicare, which is good for all of us in the long term.
What do you really have to do to make sure that the plan that you have moving on from one year to the next year is the right one?
It is imperative, given all that's going on, that consumers become more engaged and that they learn not only about what should be part of their care, but maybe some things that may be happening that are in excess, which is a big problem in our country. And at the same time also that there is opportunities to get second opinions or to learn from other places just to make sure that the care you get is tailored for your individual needs.
What is the best way? And I'm sure you've all been through this yourself, trying to cut through the contradictory information you come across.
I would say stick to the facts. There's a lot of heated rhetoric on both sides, good and bad, but that really doesn't matter for consumers. The consumers need to say what coverage will be best for me, and I think equally important, beyond my coverage and what the doctors and the hospitals do, what can I do as an individual to stay healthy, whether it's exercise, diet. We should be in charge of our health.
So I think Enola and you have shown us just how important it is to be advocates for our own health care. And next, I wanted to share with you another story that may sound very familiar to those of you out there. Let's meet Cindy, a nurse practitioner who is turning 65 and experiencing a whole new round of decisions as she becomes eligible for Medicare.
I just turned 65 and I'm employed in a job I love, and I have great health benefits, and I don't have a plan to retire anytime soon, but I've been getting lots of information from just about every insurer in my area about needing to sign up for Medicare, and it's a little unclear to me whether I need to do that now or can wait, since I don't need Medicare benefits right now. As the nurse in the family, a lot of family members ask me questions. I was looking at information from the newspaper, from a reliable source, and it was helpful but very complicated. I also saw another insert in a paper that talked about if you didn't sign up when you were 65, you would have to pay some kind of penalty. So I did clarify that with my benefits program, but I think for people in general, it's very complicated and confusing. In part, there's lots of information about the different plans, A, B, and C, and D, but not the beginning part about when to apply, what happens if you apply late. So it's kind of like getting a computer and having all the advanced information, but not the basic of how to turn it on, how to turn it off.
Well, you're certainly not alone, Cindy. There are a lot of people who are wrestling with the same things you are. We appreciate you sharing your story with us. So even Cindy, a nurse, has questions about her switch over to Medicare. But as of 2012, there were almost 50 million Medicare beneficiaries. That is about 16% of the population here in the United States. So let's get straight to the most obvious question. Why is the Medicare plan so complicated? You've got Medicare A, B, C, and D.
Well, it's complicated. Cindy's experience is the norm. It doesn't matter how smart you are, how long you've been in the field, you're going to be overwhelmed by the choices. First of all, it's complicated because you're on your own. Up till now, most of us have had an employer either make the choice for us or give us 2 or 3 choices. Now we have to learn all about it. Part A, the hospital coverage, Part B, the physician and related services, Part C, which is a whole new program, Medicare Advantage, and Part D, drugs. And then once we've got the ABCDs, we've got to figure out when to sign up, and we can make mistakes there. Then we've got to figure out what kind of supplemental coverage do we want. Do we want to stay in traditional Medicare and get a MedSup or Medigap plan plus a Medicare Part D plan, or do we want to move to a Medicare Advantage plan? And then once we've decided what kind of coverage we want, we've got probably 100 different plans, companies, and plan options to choose for. And then, just to make it worse, it's not a one-time decision. We can make the right decision now, but a year from now, we probably have to reevaluate our coverage, because even if our situation doesn't change, often the supplemental coverage does change.
Let's go back to what you were saying about the enrollment periods and some of the mistakes people make. What are the most common mistakes that you've seen? The
most common, well, when you're 65, 3 months before and 3 months after, you have this period called the initial enrollment period. Some people make the mistake of not signing up for Medicare Part B when they should, and some people make the mistake of signing up for B when they shouldn't. It's complicated, just as in Cindy's case, depending on what your employer coverage is now, what to do. A second mistake that people make is not finding out whether they're eligible for subsidies. There are about 6 or 7 million people who could be getting several $1,000s a year in benefit to help pay for coverage. A third mistake that people make is not thinking through the pros and cons of Medicare Advantage, the new program, versus the original Medicare. A fourth mistake, if I can keep going, is at some point they get overwhelmed and they just guess about what's the best coverage for themselves because it's too complicated, so they pick a name they've heard of, which may not be the best coverage. And then, as I said earlier, they don't reevaluate their coverage, so even if they made the right choice now, there's a very good chance it's not the right plan for them 2 or 3 years down the road.
When you hear about all of these complications that arise in trying to figure out these plans, I'm sure it's very intimidating to a lot of you out there. And I'm wondering, in your own experience, how you've encouraged people to cut through this complex web of information.
Right, and you listen to Jim talk about how complicated it is and the mistakes people make just to choose the plan and decide on their premium. And then on top of that, most Medicare beneficiaries have at least one, some have several chronic diseases. If you take one prescription medicine, you take 10, it becomes even more complicated deciding what your total out-of-pocket expenditures would be, and more importantly, what your clinical outcomes might be from your choice of the plan, which is why we need 900 pages for the law. We need 9,000 pages to actually get to the right place, so we were confident that every Medicare beneficiary would actually choose the plan that's best for them from a clinical perspective, which drives me as a physician, but also an economic perspective, which seems to be the main motivating force for most people in choosing their plans.
There are no shortcuts here.
Well, there are no shortcuts, but it's important. And the people shouldn't look for shortcuts. They should take it seriously. You're talking about their health and their health coverage, which is very important to people on Medicare. The average person over 65 is spending more than $4,100 out of pocket on health care above what Medicare covers. And so people should take the time, they should seek expert advice, and they shouldn't just give up and guess. They should really make sure they've got the right coverage for them. And then, as Dr. Fendrick points out, having coverage is only part of it. You then got to use the coverage and do what you can to stay healthy.
We want to make it clear there are lots of different places to go for direction, aren't there? A lot of resources out there.
There are good, and just make sure you go to one you can trust.
So if you would like some more information, we encourage you to go to our website. It will link you to the information that we have mentioned during this program, as well as other valuable sources. And now, before we wrap up this program, we have a few questions from our audience that they would like to ask you two. Are you ready? Sheila, fire away.
Yes, my questions are for Dr. Fendrick. What is a fee-for-service model, and is that model the best model?
Well, fee-for-service is a situation where many physicians and hospitals get paid for what they do, regardless of why they do it. So you get paid full price, whether it's an intervention that's going to absolutely make you healthier. It's also get paid for an intervention that may not make you healthier at all. One of the major transformations that's going on in public and private payers, and being endorsed by the Affordable Care Act, is making physicians and patients more accountable. That the fact that our healthcare dollars just don't go out for any random service, but are more focused on those services for which the scientific evidence says that it makes you better.
Our next question comes from Greg.
Yes, you mentioned earlier that we pay the most for health care, and yet we have a very low level of health. How do we go about changing that?
I love that question.
Well, I think there are a few parts to the answer. One, as Dr. Fendrick talked about, shift the system to reward doctors and insurance companies for keeping people healthy rather than for just providing lots of services. The second is to realize that health is not just about what doctors and hospitals do. It's about getting us as a society to exercise more, to eat right, to take the medications that are prescribed as well. We have to change the culture of health as well as how insurance works in this country.
Yeah, Greg, if I may add, both as a physician and a public health professor, about 3/4 of our healthcare expenditures are on chronic diseases, of which many of them are preventable. And they're outside of the healthcare system. It's how much we exercise, it's what we eat, and whether we partake in unhealthy behaviors like smoking and driving unsafely. So I think that part of the Affordable Care Act is to take a broader view of health and try to move it out of a sick care system to one of a well care system.
And Bob has a question for you now.
What is medical supplemental insurance and why is it important?
Really good question, Bob. People with insurance sometimes, after they pay their premium, don't really understand their out-of-pocket costs that come when they see the doctor, go to the emergency room, get hospitalized. It turns out that these out-of-pocket costs can be extensive, particularly in a situation where you pay a high level of coinsurance or the percentage of the bill. Supplemental medical insurance covers those out-of-pocket costs to some extent and sometimes completely. So you can imagine a situation that your security would be enhanced if you had additional insurance to cover your out-of-pocket costs.
What are the real advantages of Medicare Advantage, and what do we get for our money that makes it worth it?
Good question. So there are pros and cons. The first choice that people have to make is whether to stay in traditional Medicare, which is a fee-for-service Medicare, which usually means that you buy a Medigap or MedSup and a Medicare Part D plan, or you go into Medicare Advantage, which is an HMO or a managed care plan. The pros of being in traditional Medicare is you can pretty much go to any doctor that you want without having to get prior approval from a primary care doctor. The cons of that are that you will probably pay more out of pocket. The pros of being in Medicare Advantage are two, in my mind. One is that you'll probably pay less out of pocket. Two, you may get some extra services such as a gym membership or vision and dental. And probably the most important one is at some point in our lives when we get older and sicker, the advantages of having managed care. One system that knows about all the doctors we see, all the medicines we take, becomes very important. So there really are pros and cons to both, but you might decide to stay in traditional Medicare when you're in your early 60s, and then maybe when you're older, move over to Medicare Advantage.
Thank you very much for your thoughtful questions. Don't you agree that those questions mirror what a lot of Americans have on their mind at this hour? Thank you to all of you. Thank you to our experts. James Furman and Dr. Mark Fendrick. We really appreciate your participating in this dialogue. There is, as we have seen, an awful lot to digest from this 906-page document. You've set us in the right direction. It's a critical conversation that we need to have, and it is one that we will continue to have. Choosing the right plans and insurance for you and your family requires tremendous diligence, engagement, and most of all, a lot of patience. It can be tough, but by considering some of the excellent points our experts raised here today, you can rest assured that while the conversation around the Affordable Care Act swirls on with all of the debate, you can stay focused on what is most important, the well-being of you and your family. Thank you so much for watching. We hope we've helped you. Thank you.
The American Grandparents Association is a proud sponsor of Understanding Healthcare. The AGA is focused on the health and well-being of you and your family. Membership information available at agagrandparents.com.